As part of our program, we do two electives at the end of 5th year overseas at the hospital of your choosing, and I chose a hospital in Guatemala called Centro Medico. It's a private hospital, and so when I got there the first time, it was really quite surprising because I was expecting, like lower standards, maybe not a third world country, but like just lower standards in Australia, but it was actually quite amazing. It was like a 5-star hotel. I was taken into the hospital, people gave us a bit of food, there was like heaps of cool waiting areas, and I was really quite surprised. And then we spent a few days there just working out how the hospital worked and things. And I started to realize that the people that were in this hospital really didn't need to be in hospital, which is a bit sad. Obviously the fee to be in the hospital is akin to a 7-star hotel, like it's about $800 a night. So it really was the case that someone felt sick and they felt like they needed to be in hospital, so they admitted themselves to say that. I witnessed a few silly decisions, like there was a guy who had facial cellulitis, and obviously he needed antibiotics for that, so I was thinking maybe a bit of amoxicillin, maybe some Keflex. He was put on vancomycin and carbapenem, which is probably like the end line of antibiotics that we have. I asked the doctors about it, and the justification that they had for it was, these guys are paying a lot of money, so we got to give them the best that we have, which was a bit sad. As you can imagine, really quite quickly we got a bit bored of this hospital and asked if there was someone that could take us around to the public hospitals, and we had the opportunity to go to Roosevelt, which is the public hospital in Guatemala City, and that was a completely different story. That was the ED had maybe 50 people lined up, a guy in a stretcher face down with blood all over him, but it was first in, first serve. The triage system didn't really work well. A lot of medical students were running the hospital because I feel like a lot of the consultants are at private hospitals trying to make some money, and they supervise medical students, but it's not a high quality of healthcare. So one of the surprising things for me that I took away from my elective is, not really surprising, but how lucky we are in Australia, because in other countries the social inequality of healthcare is just gigantic. It's quite ridiculous really, that resources are present but are only present for a select few. That was a bit sad. But yeah, it did make me feel quite lucky to be in Australia and our healthcare system. The other part of my trip was backpacking around the place, and I really quite enjoyed that. Learned plenty of Spanish, met a lot of local people, started making my way through South America, caught a really silly boat from Panama to Colombia, but interesting experience, some cool people. Made my way down to Brazil for Carnival, really fun. I think this elective program is really good because it forces us to get out there, and when you're out there you also want to have some fun, so you do have a lot of fun. Guatemala itself is also a really pretty place. If you ever get a chance to go there, you should totally go there. There's heaps of cool lakes, volcanoes you can climb, waterfalls. The people are quite nice. Guatemala City is a touch dangerous, so maybe avoid Guatemala City, but there's a lot of other places that you can go to.